Hey, hi guys. So if you are a final year medicine PG about to write your theory exam in next 2 or 3 weeks time, then this video is for you. Well, this is not a revision lecture. This is not even a video telling you which topics to focus on and which you should not focus on. This is an sort of honest conversation which I wish I should have with my final year medicine PGs 2 or 3 weeks before they go for their exams. Because medicine postgraduate exams are quite strange. I mean, after functioning at your peak and absorbing everything around you like a sponge for 3 good years, when you have handled difficult patients, difficult relatives, their anxieties, done the emergency duties, the calls, and so many clinical stuff in the ward, which make you into a very good doctor in real world clinical medicine. But when you sit down in last few weeks before your exam for revision, there is a strange feeling, a feeling of underpreparedness, a feeling like, oh man, I should have started little early. थोड़ा जल्दी कर लेता तो I would have finished this guideline also. I would have read that book as well. I would have read that important topic from the medicine updates, from the progress in medicine, some recent journal articles, and so many things keep coming in our mind, where we feel, will I go blank when I write my first paper? Would I remember anything at all when I am about to write this paper? And what if I fail, or what if I underperform in this exam? If you are having any of these feelings, then well, this video is for you. So friends, there is something what I call as a memory illusion or a recency bias in our memory when such an exam comes in near future. Because the medicine syllabus in general is so vast, there will always be some topics somewhere in your textbook like Harrison, Davidson, or any other stuff that you use, which you haven't read in recent times. And your brain always tries to drift your focus towards something which you have not revised in recent times, from something which you know quite well. So you may be knowing 70, 80, 90% of the syllabus very well, but that remaining 10-20% makes us more and more nervous. If you're revising sepsis guidelines, suddenly you think, oh, I think I don't remember a vasculitis classification. You go back and read that, you suddenly remember I should read 4-5 area from hematology. Suddenly that goes to neurology, gastroenterology, cardiology, and so many things come up in your mind in a matter of few moments that within an hour it is very natural for you to start feeling, my God, I'm not at all prepared. But believe me, that feeling is not only happening with you, but it is happening with everyone around you who is going to write this PG exam within next few days time. And that feeling is often very, very misleading, because in the exam, you are not going to be asked each and every chapter of Harrison. What you need to know is only those particular questions which are there in front of you in your exam. The examiner doesn't want to know whether you remember your textbook line by line, page by page. What they want to know is whether you are able to reproduce what is asked in that question under that exam pressure in the allotted time, in the best way possible, to convey to the examiner that you have understood that topic and you know what is important clinically as far as that topic is concerned. So it doesn't matter whether you know everything or not. In fact, it is not practically possible for any normal human being to know everything that is there in internal medicine. And actually, this feeling of underpreparedness also comes from the understanding that the more you read medicine, the more you realize that there is so much more beyond what we already know in this field of internal medicine. And to accept this fact early as possible makes you that much more comfortable when you face your final exams. Now, there is another important thing, that many PGs who have been actually quite good in their clinical work and who may be actually very well prepared, they are sometimes the one who panic the most. And that panic comes from sort of comparison with your friends and peers, that somebody else might have revised Harrison 3 times, I've only read twice. She knows all the guidelines at the click of a thing, and I don't remember some of those. I had bookmarked so many videos to be watched during revision. I had downloaded so many revision PDFs sent on various WhatsApp groups with my friends and department and university, which I have not touched at all in recent time. Well, if you have a large collection of such stuff, these notes, that bookmarked video, that revision lecture to listen to in last 2 weeks, which you have not been able to listen, then congratulations. You are exactly identical to every recent medicine PG that I have seen over the years. In fact, in some way or other, all of us, including me, when we were about to appear for final year medicine exams, we were in the same situation. There was so much of stuff which was kind of mentally listed to be read in last few days that it is just humanly impossible to be able to do all that in that short period of last 15 to 20 days. So how do we go about it? So if I were to start revision for last 15-20 days today, with whatever preparation I've had till this point, what would I do? So the first and foremost is try to simplify everything. By now, you would have had access to most of the PYQs from last 5 to 6 years. Now, in those question papers, try to see what are the topics you are most likely to be examined on, and not try to conquer everything that is there in Harrison or everything that is there in syllabus of internal medicine. So what I would do at this stage, when you are in last 15 odd days before your theory exams, is select those common classifications, the common definitions, the common treatment algorithms, the recent advances related to the very common diseases like your diabetes, tuberculosis, HIV, hypertension, the recent heart failure guidelines, any newer modification in some of the common protocols of management which you know of and which have been asked in recent 4 to 5 years. The reason is not that you want to predict what you will be asked, but we want to see what is the pattern of the exam and what we are likely to be most examined on and what is most likely to be expected of us in this particular theory exam. Because at this point in time, smart work is way more important than random hard work. So what is very important here is that none of us can know everything. None of us would have revised everything when we step into the exam hall. But what is ultimately important is whether you recollect those 40 questions which are asked across 4 papers when you sit down to write your exam. Second step is starting the last leg of your revision. No new books, no new chapters, no new guidelines, no recent advances from your medicine updates or progress in medicine if you haven't read it till now. Just try to maximize what you already know. So from your high yield topics, like say you do know that there will be at least one question around fever. So either PO or fever with some rash, lymphadenopathy, joint pain, some combination of fever. You know there will be one question every year on TB and HIV. There has to be a question on diabetes. There will always be a question on heart failure or arrhythmias like atrial fibrillation. So similarly, you know what are the highly asked and high yield topics from each system. So just sit down to revise those same topics from the resources, whichever they may be, that you have already read. So always believe the stuff that you have rubbed your fingers against or that your eyes have watched before. Do not read anything new. You are more likely to recollect the stuff which you have already read before than something which you read in a lot of hurry and pressure closer to your exams. And there comes the important third step, and that is from changing your approach from studying medicine to performing in medicine final theory exam. So what do I mean by this? Do not try to absorb everything that is around you from your syllabus like a sponge, which you might have done during the 3 years of your post graduation or during the last 3 months that you in a way started your preparation leave if you had any. But what is important is when you take any particular topic in mind, like say for example heart failure, diabetes, whatever it may be, just sit down for a moment and try to recollect, am I remembering the important definition, the classification, the diagnostic tests, the management algorithm or flowchart which is there in Harrison as far as that topic is concerned. If you remember that today around 15-20 days before your theory, you're definitely going to remember that on the day of your exam. So you can just move ahead to the next topic instead of wasting time in searching for that one point which you may not be remembering in that particular topic. Move on to the next one. Because in exam, what is important is to write near complete answers of every question rather than being able to write brilliant answer for 5 or 6 questions and leaving the other 3 or 4 questions incomplete. So it's important that we write something in each of the subheadings that are asked in exam rather than trying to write a few questions that we know very well in greater details. Now here another important lesson which I have learned is that knowledge, yes, it is important to score marks in exam, but how much knowledge you have is not necessarily directly proportion to the marks that you get. Why do I say this? Because knowing medicine is different and writing an exam answer in a proper way is a different skill. I mean, here I would say you imagine your examiner. So someone in his say late 40s, 50s, or at times approaching 60s, who is doing his daily rigorous clinical work, the OPDs, teaching duties, and so many things. And then the person has to assess several students' answer sheets on the same 10 questions again and again for 30, 40, 50 students perhaps. So, what is important here for us when we are writing the exam, for the examiner to be able to give us marks, is do not make your examiner search for points to which he or she will grant you marks. So, what I mean by this, do not write your answers in long paragraphs. So, divide your answers in headings, subheadings, diagrams wherever possible, especially the basic sciences questions. Then, flowcharts wherever possible, especially when you're discussing management approach to a certain problem. Then, try to write classifications in tabular forms, in lists when you're asked etiologies, instead of writing long paragraphs. And make a sure rule that whenever you are writing something longer than 2 or 3 lines, make sure to underline the keywords. So the examiner is less likely to read each and every word from your answer sheet. Second, your handwriting, which may be good or bad. I'm sure, I mean, many people believe that doctors do not have good handwriting. But then still with the same handwriting, you have to succeed in this exam. So in your paper, the examiner is not going to read each and every point, is not going to see how good or bad is your handwriting, but they'll be just scanning through the pages initially to get those keywords, whether they are present or absent in your answer. If you have highlighted those keywords good enough, you are awarded the appropriate marks and the examiner can move ahead. Remember, he has to check answers of same questions for several students back to back. So it can be a mentally very tiring job. So do not make your examiner struggle to give you marks. Instead, make things very obvious. So there we come to answer writing and time management, where you are actually writing your final exam. So this thing should play out in your mind in the last 5 to 7 days when you're revising your most important high topics. That if I am asked something on this topic, how am I going to write the answer? Because theory exam in post graduation does not just check your knowledge, it checks your knowledge, application of that knowledge, time management, and representation of what you know in that allotted time and space on your answer sheets. So here, whenever you are writing long questions, like MDs have essay type question, in DNB you may have a long question asking various things about a common disease. Make a mental pattern, definition, common causes, classifications, important clinical features, investigations, management algorithms, complications, and important recent advances. So if you know these headings about each of your high topics, you would succeed in more than 90% of your 4 papers. Remaining 10%, it can be at times very difficult to prepare for. Now there, when you are faced with a question where you may not know much about that topic, remember a rule of 3. Try to write 3 common causes, 3 common clinical features, 3 common tests to be done in that particular condition, and 3 important management points related to that disease from your 3 years of clinical work that you have done during your residency. And with this approach, I'm sure you would end up scoring more than average marks, even in the topic which you may not be very comfortable recollecting at the time of writing your exam. Because whenever you are writing your paper, always remember that even partially written answers can fetch you some marks, but blank pages do not get you anything. So there comes the importance of managing time. When you have to write those questions in 180 minutes, you should not dedicate too much time to the topics that you know a lot about and compromise the topics which you may have to think for a few seconds before writing. So try to finish off those known topics faster so that you can give those 10-15 extra seconds to the topics where you have to really stress your memory to recollect what all things to be written. Now, what I would not do in last 15 days if I'm approaching my theory exam. So the most important part here is forget about reading any rare syndromes, any rare guidelines, any new things which you may not have read yet just because someone forwarded it on your WhatsApp groups or discussed it in front of you. Secondly, forget about comparing yourself with your colleague or comparing what you know and recollect with the whole internal medicine syllabus. Because, like I've been stressing again and again, no one can know everything. People have their different mechanisms of coping with the exam stress. Everybody around you is anxious, everyone around you can be stressed in some way or other when the exam is that close. Some try to sort of show over productivity to overcome their anxiety. Some people try to discuss too much of recent guidelines and what they are revising. Some people make very nice tables on their status, WhatsApp status or forwards: Monday this system, Tuesday this system, Wednesday this system, and so on. Do not get distracted by all those things. Ultimately, you have to only reproduce well what you already know. It doesn't matter what the friend sitting next to you knows or does not know. Another important part in medicine, although there is a broad structure, as in first paper will have more of basic sciences question, the last paper may have more of recent advances, and in the second and third paper you will have the system related question. It is not necessary that if you have a cardiology question in paper 2, you won't get another cardiology question in paper 3 or 4. Same applies to other systems also. So one important thing to fit in your mind: once you are out of the exam hall writing your first paper and about to prepare for the next day, take a break, have decent food, have enough sleep, press a reset button, and do not do post-mortem analysis of the previous day's paper. Because it is very natural that when you are going to revise some other topic from that same system, you may have the temptation of going back to that chapter about which you were asked a question in the previous paper, and then you notice, oh shit, I forgot to write this. Oh, I didn't write this drug dose properly, or something of that sort. There may be some friends who after coming out from the exam hall would want to discuss, अरे ये question में तूने ये लिखा क्या, अरे वो recent guideline में ये आया था वो लिखा क्या. Tell that friend, let me finish all 4 papers, we'll have this discussion at the end of it. So that is what I call as information quarantine. Tell the person that my first paper is already dead, your marks are already locked. It is not going to change whether you go back to that topic while you're revising for paper 2, 3 and 4. So forget about what has happened in the previous day's paper, take enough sleep. Now last 15 days, sleep is another thing which is extremely important, because all of us know very well as doctors that sleep is the time when memory gets consolidated. So, I mean, you won't get so much of advantage reading 1 or 2 extra new topics, compromising your sleep in last 15 days, as you would get if you have proper peaceful sleep, where you're fresh enough on your exam days to be able to recollect the vast amount of knowledge that you have gained during 3 years of your residency. So please do not compromise your sleep in last 15-20 days before your exams. Now I would end this video by telling a personal experience. So when I appeared from my own DNB medicine final exams a few years back, I mean almost like 13-14 years back, after finishing all my papers, I always had this experience that while preparing for the next paper, I used to sometimes see the topics of previous paper and feel, I could have done better. I knew this thing, but somehow I missed writing it in the paper. At the end of the theory exam, I felt, well, the papers were good, but maybe I could have done better. At the end of the practical exam, it felt like, my God, 3 years of hard work, and these people just judge you on basis of those 6 or 7 hours of intense early like kind of assessed practical exams, and you sometimes feel, is it really good enough that I'm judged in such a short duration for my 3 years of hard work, and what if I underperform? Well, I'm sure all of you also are likely to go through all these feelings, but remember, even after feeling that I had kind of underperformed in my theory exam and I had kind of very hard intense practical examination at an external center in one of the medical colleges, when the result actually came, I just didn't only clear the exam or top in my institute, but I got the highest marks in the whole country and stood first in DNB medicine. So all these feelings, although they are quite natural to occur when we are approaching a stressful exam like final year medicine exams, always understand you are way better than you think. You are much more prepared than you feel in those last 2 or 3 weeks of approaching your theory exam. And most importantly, no doubt, give enough importance and seriousness to preparation of this exam, but always remember this too shall pass, and this is just one of the important steps in your career, but it is not going to define what you are as a person, nor is it going to define how good clinician or how successful doctor you are going to be in future. Because believe me, retrospectively speaking, when you look at this period, you would always feel, well, I was actually much better prepared than I believed in myself. So, all the very best. In last 15 days, just focus on the high topics, focus on having enough sleep, and quarantine yourself mentally, quarantine your psychological bandwidth from unnecessary distractions, and especially the postmortem analysis of the prior paper, because you would have back to back papers across 4 days. All the very best, and I'm sure all of you are going to have this feeling after your exam that yes, I was much better prepared than I believed initially.